Hello, my name is Chaz Pierce. I love helping people with health insurance. It's my job to simplify the complex and at the same time help clients avoid costly mistakes. But first, you should know my qualifications. I was raised not to brag about myself, so this is a little uncomfortable for me. I have been licensed since 1989, so that's over 3 decades in this industry. Most of my career was spent with 3 different health insurance companies. I started off as a producer and then progressed to what's called a company rep position, which is where you support about 500 producers. Then got promoted to manage company reps, and overall I had a responsibility for a third of the state of Texas, a third of the United States at one point, and issued over $1 billion in coverage. I also hold a professional designation called RHU, which stands for Registered Health Underwriter. This just means I took special courses to gain an extra in-depth knowledge of certain topics within the health insurance industry. So this designation is over and above your basic insurance license. In addition, I have served as a continuing education instructor to help producers maintain their state licensure requirements and stay sharp in their knowledge. So in a nutshell, you're getting expert advice from me. However, the most important thing to know is that I perform as a fiduciary, and that means I always put clients' needs first. I hold myself to a fiduciary standard, whether or not compelled by law to do so. Enough about me. Let's talk about the overall categories of health plans. I like to use a simple grading system like the ones you used back in school. Rankings are A through F, and I'll dive a little deeper on A through C in a couple of minutes. A is the best, and it's group coverage. B is still really good, and it's ACA, or Affordable Care Act. And C will get the job done for certain individuals, and it's called short-term medical, or STM. And then you'll notice my quality bar. I have been around the block, and I know better and will not offer the plans below that bar. These would be things called indemnity plans, which are not based on your incurred medical expenses, and they can leave you with big hospital bills in the tens of thousands or even hundreds of thousands. Ministry plans, they are not regulated by the Department of Insurance, and they have been outlawed in several states. And then finally, the worst of all would be your specified disease type policies. These typically are a win for the insurance company, they're a win for the agent, and they are a losing proposition for the customer. And they're primarily sold by bad actors. It would be much better to get a disability income policy, and possibly in conjunction with a living needs life coverage. All right, let's consider group and especially COBRA for a moment. So a lot of people will get sticker shock when they see the COBRA rates. And the reason is it's usually the full cost without any help from the employer, plus there is an additional 2% administration fee. The length of time that you're allowed to stay on that COBRA depends on what happened at the separation of service with the employer. So if you resigned on your own accord, you get 18 months. If you happen to be disabled, you have 29 months. And for other circumstances such as death and divorce, you're allowed to keep the coverage up to 36 months. You do have 60 days to decide to make your decision. And you'll notice on here that there are a lot of items which are the same. And you'll see it's got the same ID card, the same prescription, same providers. But the real key consideration to make here is what is the premium and how much of your deductible and maximum out-of-pocket have already been satisfied, versus if you went to a lower premium and you had to start over on a fresh deductible and out-of-pocket. So that's the real decision-making when it comes to looking here. Next up is an overview of the Affordable Care Act plans. These plans are best for lower to moderate income folks and or people with existing health conditions that they want to be covered by the plan. These plans are all guarantee issue, but they do have rules associated as to when you can apply. General rule number one is you have to enroll by the 15th of the month to get your coverage to be effective the first of the month following. So that's rule number one. The next rule is that there is an annual open enrollment period for January 1st start dates, and that period runs from November 1st to December 15th. Now, occasionally there will be extensions granted by presidential executive order. So those vary as far as what those additional dates may be. So the next way to qualify if you're outside of the open enrollment season is by having a qualifying life event, or QLE. This is things like marriage, birth, moving from one county to another, and more. And the rule there is you've got 60 days from the QLE to apply for your coverage. So these plans, they definitely look more attractive when they have the tax credits associated with them. So the higher income you are, the more premium you're going to pay. The lower income you are, the more help you're going to get. And even some people can qualify for zero premium, and others also get help with their deductible and out-of-pocket. So in this category, there are lots of news here. And even if it is the same company, you may have a new ID card, you may have a new plan type, so you may go from a PPO to an HMO, for example. You'll have a new deductible, new out-of-pocket, and it's really key to watch for disruption. There can be a different set of providers, even if it's the same company. They may have different providers, a different prescription lists, and so forth. So we just have to examine that to make sure we get you into the right plan. So let's expand on how the tax credits work. So first of all, this is authorized by law and administered by the marketplace. When you determine a household, you do not define that as the number of people living under the same roof, but who is on your tax return. And they also use the estimated adjusted gross income. So this would be how much you expect to make for the year ahead, and this would be after business expenses, and anything that is over or under is all finalized with your tax return. So these tax credits are paid directly to the insurance company, and you just pay the difference. So for example, if you choose a plan for a family that was going to be $1,300 total, and you were eligible for $900 worth of tax credits, then your portion would be $400 a month that you pay directly to your insurance company. Now, sometimes the marketplace will require additional proof to be sent in. It's not something that has to be done right away, but usually within a month or two, you have to provide things such as citizenship or maybe some sort of proof of income. But just definitely want to do that anytime you get any correspondence from the marketplace. In addition, certain individuals are eligible for what's called a cost share reduction. So these are typically for people that are in lower income brackets. And so in addition to help with the premium, they get several options, which are using lower deductibles and maximum out-of-pockets. However, they must purchase in the silver category to be able to select those particular plans. Also, the ARPA, the American Rescue Plan Act of 2021, did expand the upper range of incomes. So you may have not been eligible previously, but now you could be. So you definitely want to check that as well. Next up to review is the short-term medical. So you may have missed the open enrollment or missed the window to apply for your qualifying life event. That would be one reason why you might want to purchase the short term. So overall, this is the best option for healthy, higher income clients who are not eligible for tax credits. But the key consideration for folks to think about here is to weigh the cost versus the quality. So this is what I call an old school plan. So it's how insurance was before the Affordable Care Act was passed. There's a couple of positives with this. They're usually either a PPO, not an HMO, or maybe they even have open access to any provider. You can apply for these plans anytime during the year, 365 days a year, and they do have flexible start dates. So you could begin coverage tomorrow, for example. But you do want to read the fine print. You do have to qualify medically, and it's not usually that difficult to do, but there are some knockout questions on the application, and most of those are just asking about major health conditions. And usually there is no coverage for pre-existing health conditions. So if you plan on having some sort of existing condition paid for by your insurance, you really need to be looking at the Affordable Care Act options as opposed to these. In addition, there is a reduced scope of services. So for example, they do not offer maternity coverage or mental disorders, that kind of thing. And then also there are plan limits. So a lifetime maximum or an annual maximum, prescription maximums, things along those lines. So just in general, you want to check the fine print and make sure you're making a good decision with this. Okay, drum roll please. Let's see how the rates compare. So what I did is looked at a female 41 with 2 kids, and this is October 2021 rates in the Dallas-Fort Worth area. So if you're looking at COBRA, you know it's going to be over and above the full cost of the Affordable Care Act almost every time. In general, I like to ballpark most employer COBRA plans at about $500 per adult and about $250 per child if you're just kind of doing the back of the envelope math. So then you can look at the Affordable Care Act plans, and these are, there's 2 carriers here, and one is more of a low-cost type carrier, and one is the more expensive, full service, a little bit better known brand, all that kind of good stuff. So you get a $50,000, you can see you get a substantial amount of tax credit applied to your premium. And then you can see you get less and less as you go up. So 75,000, 100,000, you still get tax credits. When you get to the 150 plus, you're beyond the tax credits and you're paying for the full cost of the Affordable Care Act. So if you're in that category, a lot of people would then want to ask, well, what are my lower cost options? And that's where the short-term medical comes in. I've got 2 carriers there. And as I mentioned before, kind of a trade-off consideration of cost versus quality when you're looking at ACA versus short-term medical. And the rates that I have on here, they do not include what a lot of these companies will do as a discount for paying the whole thing up front for the year or for maybe 6 months at a time, that kind of thing. So there's typically a pretty nice 20-25% discount for that. And finally, here's how the consultation process works. First, we intake your personal information, demographic stuff, age, date of birth, that kind of thing, health, medications, doctors, income, and then we'll schedule a meeting. Then I'll go to work, do the homework, do the market research to figure out which plans are the right fit and so forth. And then we will do an online meeting to review your particular results, scenarios, that kind of good thing. Then at the time you're ready to make your decision, we can get you enrolled and get you all set up with your ID cards and all the back office information that you're going to need to use your plan fully. And so just in general, as you can see, this whole thing is a very complex decision, but we can work together to sort through your needs. And if you'd like to get started, contact info will follow. Thank you so much.